Dr. Coleman, why and when is medical detoxification important for alcohol?
Alcohol detox is important for a lot of patients, and there's a gradation of how dependent the brain is and how easy the brain and the human body will tolerate alcohol withdrawal. You know, detox is necessary because the body becomes dependent on these drugs, and so the brain chemicals and the brain receptors and the systems change to become used to it, so that when that alcohol is no longer there, it then goes through this withdrawal reaction. And withdrawal, I've always said, is the opposite of the clinical effect. So alcohol is a sedative. If you give people too much alcohol, they go to sleep. So when you come off alcohol, you get this agitated state, mainly produced through norepinephrine or adrenaline, and it's this hyper-agitated state. So you see symptoms of high blood pressure, pulse rate, sweating, nervousness, can't sleep, just agitated. And sometimes that agitation is so strong that it's almost like cross circuits and you get this seizure. And at its peak, you can also get confusion and delirium, so what we call DTs. And I remember in medical school hearing that the fatality rate for DTs was in the 30 to 40% range. That was 1980, so a long time ago. But it's improved a lot since then. But the bottom line is untreated alcohol withdrawal can be very, very dangerous. And so what we have to look at is how dangerous it is for this particular person. We know people in their teens and 20s tend to go through alcohol withdrawal pretty easily. Their tolerance isn't as high and their body tolerates it better. But as you get into your 30s and 40s and 50s and 60s, it gets worse and worse, because you're drinking more, your liver's not as good, your kidneys aren't as good, your whole body systems, your brain's not as strong and is not as tolerant or is not as able to stand the withdrawal stress. So we look at all of those things and decide, you know, does somebody need a medical detox? And we don't want to take any chances with people because there is this fatality and severe danger rate. So we're looking at all of those things to determine, you know, does somebody need a medical detox or can they just stop on their own?